Sarah Jane here from the Rehab Hub, and I'm on talking about weeks 3 to 5 of Achilles Tendon Rupture. I ruptured my Achilles. It'll be 5 weeks tomorrow, and this is the journey so far here. So today in this video, I'm going to go through the VacoPed Boot. So I'll go through that boot with you. I'm going to go through the rehab demo from weeks 2 to 5. And talk about what rehab you should be doing, depending on the protocol that you're following. This would be the non-surgical route, so I'm not having surgery or had surgery for my Achilles tendon rupture. And we're going to talk about that journey to getting out of the boot. That's about, we'll get to parallel about week 10 and out of the boot by week 12, thereabouts. So, first things first, the last video that I did, I was still in the NHS boot that I got given at the NHS Greater Glasgow and Clyde. I purchased the VacoPed Boot, which is a device, it's an orthotics device. Now, I am an MSK podiatrist, so I had heard of this from colleagues, and I knew there was better functional rehab for this injury. So it was worth the investment. It was just shy of £300 and worth every single penny of it. I also, I think you saw in the last video, I purchased the Even Up. Really important for your posture. I got this from Algio, the supplier I use anyway. You can go into Amazon and buy this. The links are below if you're looking for this. This, I think, was 30, 40 quid. Really, really important for making sure that you're leveling up, because when you're in a boot, regardless of what boot it is, you're going to be taller on the side that's got the boot, and that's going to really massively affect your overall biomechanics, posture, leave you vulnerable to hip and knee pain, which we don't want. So let me show you the VacoPed. So I'm just going to remove myself here, and I am going to take my boot off. I'm going to show you the boot and go through the good, the bad, the ugly, all of the stuff. So if I jump up onto this plinth, you can see I'm wearing the boot just now. It is super comfortable, more comfortable than my last one. So this is it here. Now, essentially, it's got 4 straps and it's got a vacuum seal. So basically, it sucks out the air and turns this inner lining into almost like a cast. So if I take it off, 3, 4 straps, as I said, you've got your outer shell. You've then got your outer shell here, and then the shell that goes over the top. So in terms of this, what you've got is you've got this rocker bottom boot, which allows for great ambulation. I ordered the medium size. You can get small, medium, and large. And I'll come up closer once I've got the boot back on again and show you how we adjust via a little key. But essentially, it allows for much easier ambulation, and it allows for functional rehab of the Achilles tendon through all of the weeks as you reduce the angle of the ankle. So from here, you get in your pack, it's a nice fleecy lining inside. You get 2 of these. Now, I've not brought my little vacuum pump, so I'll not take this fully off, but it's like a little pump that you get with it that you, not a pump, it basically sucks the air out of it. So I'll not totally deflate it, but inside here, they're little, the only way I can describe it, it feels like little beads. And when I deflate that and let the air back in, or inflate it to let the air back in, that you're able to move the beads around, and then you then put it on, wrap yourself all up in it, put your boot fully on, and then you suck the air out of it and it hardens like a shell. So I'll leave this like this just now. The great thing about the VacoPed is that you get 2 covers, so you can have one in the washing, which is, let's face it, very, very welcome. So that's the boot. That's how easy you get it off. Now, I am heading into week 5. So from about week 2, what you should be doing, what you should start doing, is getting plantar flexion. So you can see here, I'm getting into this, pointing the toe down and actually working through the gastroc. So getting this activation through gastrocnemius and soleus, and then just back to, not to neutral, no dorsiflexion at this point. So you're just activating and then releasing. So you're not actively engaging tibialis anterior, you're just keeping the shin area relaxed, and you're just going into, but you're trying to get the muscle at the back just to engage a little bit so you can feel it. spreading your toes. I also had some little inversion and eversion, but you can see here that I'm keeping the foot in this plantar flex, this pointing down position at all times. I'm not dorsiflexing at all. So I'm not bringing my toes up to my shin at all. So this is about week 2. And week 2 to week 4, this is really all you're doing. Now, in terms of at that stage, from about week 2, you should be taking your boot off every hour or 2 for about 5 minutes and doing this. You can also be scrunching your toes to get those intrinsic muscles activated in the feet and just moving the toes about and just getting the mobility around the joints around. There's 33 joints in your feet. So I don't know about anybody else watching this, but I get quite a bit of cramp around the midfoot where both boots basically are restricting that motion around that area. So actually just loosening that off has been quite nice. Now, at about week 4, I'm now coming into week 5. What I've started to do is same movement, same rotation, but I've just started to just slightly, not going up to neutral, but you can see I'm just activating tibant just a little bit, nothing major. I'm just feeling a little bit. As soon as I feel any kind of pull, I back off. And I'm just plantar flex and honestly, 2-3 degrees of dorsiflexion, nothing major. But I'm already within my boot. I've already altered this down by 10 degrees. So I'm just now facilitating this dorsiflexion moment that I'm already doing in the boot anyway. So it's not anything. I'm not overstretching this. Obviously, we don't want the tendon to heal long. So that's that. And this is pretty much the rehab at this point. You're just getting that mobility and a little bit of plantar flexion. And at week 4 to 5, just that little bit of dorsiflexion, back to that. I mean, honestly, I'm lucky if I'm going 5 degrees here. So I'm being really, really cautious, and it's better to be cautious than not. So that's the demo mainly. I know it doesn't look like anything, but it's just those mobility exercises, inversion, eversion, no big full circles, nothing major, just scrunching the toes, then releasing and just splaying the toes, all good. Just getting that mobility, motion and movement. Okay, what I'm going to do is I'm going to pop my boot back on. I'll show you how easy it is to get back on. So my routine for putting the boot on is I'll usually do it. I usually do it in bed if I'm doing it at all, but I usually have it up. I do the bottom bit first, and then I do my top bit. I usually just keep I'm usually wearing some sort of kind of yoga type pants anyway at work, and then like so, I'll then maybe put my foot down, or I'll maybe just do it in bed with it as well. Great thing about these as well is that you can get covers for the bottom if it's raining or muddy outside, so that you're not, because obviously you're sleeping with this one as well, so you can cover it up if you're going outside actually walking. I'm not using crutches at all. I've not really felt like I've needed them. I'm absolutely fine, just being careful, not being silly. I'm not doing too much, sitting down when I need to. I then put the outer shell on. Don't know if you can see that. So here, I then put the outer shell on. Now, I always, and I would recommend this, so the first one's down near the toes, go inside, go inside, go inside to the little bits. Then I always do the one at the ankle first. Get that one. Cross. Then I go to the toes. So I have a bit of a system. Toes as tight as I can. Then I go up. And then I go up to the top. And that's it. And I really don't take it off. There's nothing other major that I would do to that. Now, if I had let the air out of this vacuum seal here, I would at this point pump it up. And then as I then put my foot down, I would then tighten these up even more than a stand. I would just make sure that they're really well and truly tightened. And that's it. So you can see I'm able to fully walk normally. There's no, I mean, it really is a great boot. It's really worth looking at. Now, the keys to this, I'm going to take it off again, but what I'll do is I'll jump onto the other camera and show you a bit closer. The key with the VacoPed is, maybe tilt this camera down and show you a bit better, because I want to You really see the ease of this boot. I am not commissioned. I really just do rate it. I actually saw a patient today in my clinic who had ruptured his Achilles, and he had just come out of his boot, and he was in the same boot that I was in, the NHS, and he was, let's just say, he's like, I wish I had known about your boot, I can't believe. And yeah, he's like, that would have been so much better and easier. But anyway, so here is the boot close up. So I'll take it off. Okay, 4, off your outer shell. You can see here. Now, what makes this boot, so I'll not take all that off again, but what makes this boot magical is this here. You see this? So you adjust on these things. You get a little key. So the key just actually hooks onto the back of the boot, and you adjust it quite literally like this. You see that? And that will allow that to go down. So basically, so if I was, when I'm going all the way down to the bottom, can't wait till I get there, I'll get this amount of motion. So when I'm moving, the boot will start to move with me. So you can see, and the beauty of that, and I can't stress enough, you can see that I'm taking, so when I'm fully at that lowest part, I'm fully getting into that dorsal position, and you need that for normal ambulation. What my patient this morning was finding, so he's out, his tendons healed, but he's 2 weeks out the boot. He's actually come out of it quite early, which the NHS had their protocol that we're using, Grace, Glasgow and Clyde, which is a bit sooner than what I would be. I'm coming out. What I don't want, and I know that the re-rupture risk is very high, up to about 14 weeks after this. So I do not want to re-rupture this. So I will be in this for the 12 weeks. I've got no, I mean, I'd rather be cautious and make sure that I heal well and I don't re-rupture. But anyway, he was really finding that his gait is so restricted and tight and so on, and he's still really inflamed and stuff. I have none of that. I have no swelling, I have no inflammation. My foot is pretty good nick, to be honest. I'll show you. It's not bad at all. So you can see no swelling, and I've got redness because this is where obviously I'm in this tightness of the boot, but there's really no, there's no visual, it's annoying, there's no visible thing that you would look at and go, oh yeah, you've got an injury, it looks fine. So yeah, no problems at all there. But his is still really quite swollen, and he's really restricted. So it is just the position that he's been in. So yeah, I cannot recommend the VacoPed enough. What does it cost? To be honest, I think the cost of it is about, just for the boot itself, about 260 or around that, 260 quid. So you can see how fiddly it is to go on when you're on the ground. So I usually will straighten my leg, so I'm in that plantar flex position even, put it on, and then you always feel safe as soon as you bring this bad boy over. But obviously I need to adjust. So I'm on 2 bits down. So we'll open it up. Back up the rope. I'm just taking it down 2 rungs, and then tomorrow we go down another rung. Excited. You can see there, that is me adjusted it. There's no faffing about with having to put wedges, and you can see that's where I store my key, so I can just put it back. I don't need to think about, I need to go and chisel out a wedge, have I took the right amount. It's so easy, it's accurate. You've got a protocol. I'm usually coming down 2 of these a week. What I do, I don't do 2 at the one time. I'll do 1 tomorrow, then I'll leave it about 3 days, then I'll do another one, and then I do that every Thursday, and I keep doing that until I get to level, till I get to neutral. And this week you feel good, you're like, oh, okay, I'm safe. Feel all like, oh. And round about week 10, I'll get to neutral. And then once I'm at neutral, you don't just come straight out of the boot. There's see how this is like a rocker bottom at the bottom of this boot? The boot goes to, you get another bottom bit for it. It's all included in it. And it's a flat boot, bit heel, basically, the bit, a full bit. I'll show you when I get this up. But basically, it's another part. And what that does is it just allows you to get into that full neutral. And then from there, usually you would do 2 weeks with it in neutral, just to protect the tendon. And then from there, you're out the boot. Now, you can see it's rocker bottom. The other one that I've not brought to work with me, it's still at home. I'll use that for the last 2 weeks, and then that's it. But you can see it's quite a funky boot. It is, I'm not going to lie, a lot, I feel like Robocop or something in it. It is a bit funky, try to show you. But it's comfortable. It's super easy to walk in. And with the level up, or the even up even, see, I just tighten it up. As soon as you stand up, certainly after you've sucked the air out of it, you know, I can balance, I can just do everything. I mean, honestly, it doesn't restrict me at all. I don't feel restricted one bit. So that is the VacoPed. So there you go. What I would say is, certainly if you're in the Glasgow area, so the patient I had in today was kind of a bit like annoyed because he, we're disappearing. He was a wee bit like, I wish I'd have known, because he didn't do anything. He just had done what he just basically was in the boot, and that was it. He wasn't doing anything, as that's what we've been told. And there's so much more out there. He didn't know about the VacoPed Boot. He didn't know that he could do rehab in this protocol that I'm using. It's not just my protocol; it is a set protocol from research. So get early intervention. What I would say is look out for physios or MSK podiatrists. So I myself am an MSK podiatrist, so lower limbs are my things. And you want to find somebody that's used to dealing with these injuries, or somebody that's got experience of these injuries, so that you're getting the right advice and the right treatment, because it really will help your overall management and your results at the end. But also, it's 3 months. This journey, like I've been in the boot, is 3 months, but then you've also got the full recovery is 1 year. It's a long time. What you don't want is V-rupture or it healing long, and then you've got loss of power. So it is worth the investment. My protocol is, as I've said, I've shown you my rehab, I've shown you what I'm doing. I do that religiously. I'm good with it. I actually, can you believe it? Last weekend I went for a swim. So I have my old NHS boot that I just use for in the shower, and I went for a swim. So I actually swam, which was fantastic, with my boot on. So I didn't use the inner lining. I just used the plastic casing, which is not great to walk on, but you're not walking far when you're swimming. And went into the pool. Can you really swim properly? No. So I did about 4 lanes, which was it's like you're very buoyant, because the plastic kind of floats up. One side, so my right leg was like going up and trying to drown my head in. But you can still do it. But what I did really love was I was able to do a lot of other rehabs. I was able to get my body weight up. I was able to almost kind of jog on the spot in there, get my heart rate up a little bit, and some other rehab in the pool. And it just felt so nice to do that. So you can do these things, but it's just that reassurance and guidance, support, what to do, how to do. So make sure you find a good healthcare professional that can help you with that. If you're in the Glasgow area, please reach out. The client today asked me, he's like, when should I have come? Literally as soon as you've done it. Get yourself to A&E, so you're referred to the fracture clinic, because you want to be on the system. They certainly, if you're in the Glasgow area, they will put you in an air cast boot. They're not bad boots. I use mine, as I said, for swimming and in the shower, so that I can just stand up in the shower and don't need a chair and stuff. Well, I've got the chair there, but don't really need it. I just shower normally with my other boot on that can get wet. So it's very doable, but you don't know what you don't know. So, but certainly what I would do in here in clinic is I would fit you with VacoPed and get that for you. You would get that usually within about 5 days. So the sooner the better we get you in that, because it's functional rehab. Really by week 2 you would want to be in that. And support you through that. And that support can look like anything, whether really seeing you on a weekly basis. That was for 12 weeks. That would really be what we'd be looking at. And then after about 12 weeks, once you're out the boot, support with your rehab, and then going to like 4-week to 6-week reviews up to that 12-month mark. So you're really getting supported all the way through it, because that re-rupture rate, you're high risk up to about 14 weeks after the injury. And then, but there's still quite a lot of re-ruptures, or there's still re-ruptures up to a year after. So that's kind of where your tendon's still healing. You've still got work to do. So here, what we've got is we've got the Achilles Tendon Rupture Clinic, and that insists, so we do the protocol where we will scan you. We'll basically look at how far apart the tendons are. We'll have a look at what's going on. From there, we'll get you into the right position, making sure we put the foot and your VacoPed is put at the right range for you. At the right stage. So we'd be monitoring that. So generally kind of weekly monitoring that for you, and helping you reassurance with putting your boot down, right, this needs to come down another 2, and actually checking that as we do it, that it is time to do that, your tendon's ready to do it. Encouraging and supporting you with your rehab. We would also, within those appointments, do low-level medical grade laser therapy for tissue repair and healing. And we would also do magnetotherapy, tissue repair and healing as well. We would also, by about week 4, start to do some manual therapy into the tissue. So what that would look like is very, very gentle, encouraging the scar tissue. So we would just be gentle around the scar tissue, but going up into the calf, and just, you know, the patient has into days like, I can't believe how good that feels, just get that all eased out into the tissue, and having somebody there that knows what to do, how to do it, how deep to go, feel the tissue, know the tissue, look at the tissue through ultrasound, and really see what's going on there. It really is, I can't explain, it feels amazing. And really good for helping with inflammation, that kind of edema, if you've got any of that there as well. So it just helps that recovery process, and it helps the collagen, the fibres and the alignment, and getting everything healing as it should. So that's what we would do. A protocol would be get in as soon as you can, get you into a VacoPed boot, we would order that here, we would fit that here, and your kind of full package. So you would normally be certainly a few £100 your first session because of your VacoPed, get you going with all your rehab. So we'd get that all ordered, and then a weekly appointment, and your weekly appointment would be £60. So you pay that each week you come in, and that would be for a minimum of 12 weeks, and then usually a monthly appointment for 12 months until you're fully recovered, and then you would be discharged, and that's it. So that is what we do here at the Rehab Hub in Glasgow. I hope that's been interesting. I hope you've enjoyed seeing the VacoPed boot. I have to say, I don't know if you can probably tell from my demeanour, maybe I'm a bit chirpier. I think the last video I did was week 2 or week 3. And it does take you a bit of a moment to get into the swing of this, but I have to say, I don't really even think about it anymore. It's not really, it's just, yeah, it's okay. It is okay. It's not, I think not being able to drive is probably the frustrating thing. It's my right foot, so I can't drive. Apart from that, pretty much everything is normal. But yeah, so if you've ruptured your Achilles and you're freaking out, just, yeah, chill. But if you're not in Glasgow, seek and find somebody that can help you with the VacoPed that's following the VacoPed protocol. That protocol should consist of diagnostic ultrasound, so ultrasounding it to check the tendons. It should consist of the use of the VacoPed, and it should be the rehabilitation with that. It's all 3 of them. It's not just sticking your VacoPed and leaving you to it. It's all of that. So it's the protocols with the rehab, it's the diagnostic ultrasound scanning, and the brain's just gone. So yeah, the VacoPed, the rehab, and the diagnostic ultrasound. There we go. So it's those 3 things. So it's those 3 things that make that protocol. But that's the protocol that I'm following, and it is very early accelerated recovery that I'm doing. So rehab from week 2, not from, I think a lot of the protocols are like week 8, 9 before they get you doing anything. Nope. Load that tendon. We now know, research shows that we need to optimally load tendons. We need to optimally load those tissues to get the best results. But the key there is that optimally load, and that is why all of that goes together with that diagnostic ultrasound. So we're checking where the tendon is, but also the the rehabilitation and checking at the right stages. So yeah, wee bit of hand holding, but you're just above that. And it probably gives you that reassurance that it is all healing properly, and you're all right, and you will be all right. All righty, that's me. I'm going to sign out. Hope you enjoyed, and I'll do a video in the next couple of weeks and show you what I'm at, what's happening, what rehab's looking like, and hopefully it inspires you if you're going through this injury. Hopefully it kind of cheers you up a wee bit, gives you a little bit of encouragement that everything will be all right, you are fine. And yeah, if you're in the Glasgow area and you need help with this, do not hesitate to reach out at the Rehab Hub. I'll maybe see you soon.